that will be covered by Dr. Meenakshi Swaminathan. She is the Director of Academics at Shankar Nethralaya.
Are you all hungry? We'll all go to lunch together. What do you say? All right. So if you're shown a Hess chart or diplopia chart in the exam, it usually means you're doing well. Okay? And you've usually been shown all these other charts before that was covered. And so actually feel good about yourself if you're shown a diplopia Hess charting. So just a couple of slides about the principles. So diplopia and Hess charting are subjective methods. They use different ways to induce diplopia, helpful in assessment of incomitant strabismus. Remember that patient should have an incomitant strabismus and usually acquired, okay? Not necessarily, but usually acquired. So diplopia charting uses a single stimulus to dissociate the eyes, and basically you record the separation of the diplopic images in the 9 cardinal positions of gaze. That's what a typical diplopia chart looks like. Okay, red in front of the right eye by convention, green in front of the left eye. So what do you ask yourself? You're going to ask 2 questions when you're shown a diplopia chart. Is it crossed or uncrossed diplopia? And the color, the red color or the green color is higher or lower? If the red color is higher, it means the right eye is higher or lower? Lower. Okay? So let's go back to this. Here, is it crossed or uncrossed diplopia? Red before the right, remember. In up gaze, is it a crossed or uncrossed diplopia? And remember, this is what the patient is seeing. Okay? So without much ado, this is crossed diplopia. And what is the position of the right eye? The red before the right eye. It's below, so the position is hyper. All right. Remember that? We're going to come back to diplopia charting, and you're going to solve a few ones. Okay. It's not usually plotted routinely. You will be asked to do it if you get a palsy patient in the exam. Cranial nerve palsy in the exam, 3rd nerve, 6th nerve, you will be asked to plot it. So that's where it will be important. Hess chart is based on foveal projection. Herring's and Sherrington's law of innervation are the principles, and dissociation of the eyes by complementary colors. Again, useful only in concomitant strabismus. The prerequisite that the patient must have normal retinal correspondence and central fixation, and it should not be only used for assessment. You have to have clinical assessment as well. You have to measure the patients in all gazes. You have to do ductions inversions and also do a Hess chart. It helps in assessing progress over time, helps in planning treatment, and evaluate the results of surgeries for incomitant strabismus. So let's go stepwise. What are you going to ask if you're given a Hess chart? Which is the affected eye? And how do you know that? It's the eye with the smaller field. Second question, is it mechanical or neurogenic? And we're going to see examples of that in a minute. Which are the underacting muscles? Which are the overacting muscles? And then you come together and say, this is the diagnosis. All right, so what's wrong with this? This chart, look at it. It says green before right eye, green before left eye. Clearly, it's a wrongly done chart, okay? So if they trick you into this, it means you're ready for the gold medal. So you usually will not get very complicated things in the exam as well. This looks like a complicated chart. So how do you know if it's a mechanical defect? You have a compressed field with a limited muscle sequelae. Look at that. The field is compressed. Can you see this? And how do you know it's neurogenic? Because the smaller field with proportional spacing, muscle sequelae is common, and that is how it looks. You see the inside square and the outside square are fairly parallel everywhere, the distance. So that is typical of a neurogenic defect. Once more, compressed field, mechanical, fairly parallel between the inside and outside circle, then it is a neurogenic field. Anybody can tell me quickly, why do we have two things there? Why not just have one? Why is there an inside plotting and an outside plotting? Because in very subtle paresis, sometimes the inside will almost look normal. So the outside plot is what will tell you really what is the problem. All right, let's go through some examples. Okay, remember the questions, okay? All right, first one, which is the affected eye? Right eye or the left eye? Right eye, the one with the smaller field. And the next question, do you think it's a neurogenic or it's a mechanical? fairly parallel. Look at that, fairly parallel between inner and outer. So it's a neurogenic field. What is the underacting muscle? What's that? It's the lateral rectus. Okay? Overacting is the contralateral medial rectus. So what's the diagnosis? Right six-nerve palsy. Are you warming up, or is it hypoglycemia pre-lunch? No? Okay. Or is it just Hess charting? All right. Six-nerve palsy, right eye, correct. So let's do another one. It gets a slightly trickier. So which do you think is the affected eye? They look fairly similar, don't they? So probably bilateral. That's possible too, remember. It could be bilateral, whatever you're dealing with. Think it's neurogenic or myogenic? Mechanical. Neurogenic, look at the spacing. It looks almost the same everywhere. See that? Which is the underacting muscle? So we have determined it's bilateral. So which is the underacting muscle? What's the muscle there? Do you see, am I going too fast? So this, perhaps I'm going too fast. So this is what the normal square should be in a square, and this is what the normal outer square should be. And this is falling short. So what is the muscle here? Superior oblique. And what's the muscle here? Again, superior oblique. So it's a bilateral superior oblique palsy. All right? Okay, one more here. What do you think? It's mechanical? Oh, no, first of all, which is the affected eye? Right eye or left eye? The right eye. Agree. Do you think it's mechanical or it could be neurogenic? Yeah, it looks maybe neurogenic, maybe mechanical, but it does look a little bit funny compressed here, right? Which is the underacting muscle? Inferior oblique, slightly extending to superior rectus also, but you can tell elevation is limited. And correspondingly, there is overaction here. You see that? So what could be causing elevation limitation in adduction, that is inferior oblique direction? What's the diagnosis? Limitation of elevation and adduction. Could be inferior oblique paresis, but a good differential is Brown syndrome. All right? Brown syndrome. All right, next one. Affected eye. What do you think? This is smaller than this. Come on, there are arrows and this is not even complete. Okay? So the left eye is the affected eye because it has the smaller field. Neurogenic or mechanical? What do you think? Come on, shut out. Neurogenic? How many think it's neurogenic? All right, you're right, absolutely right, neurogenic. Underacting muscle, superior oblique, and overacting muscle. It's the corresponding inferior rectus on the other side, okay? A little bit of inferior oblique overaction as well. You can see this is slightly gone outside, all right? So diagnosis is left, superior oblique palsy, that's right. You can speak up, you're right, on the right track. Okay, affected eye, left eye, how many think it's left eye? All right, and neurogenic or mechanical? Looks like mechanical, right? It's kind of stretched out, up and down. So what do you think is going on here? Elevation seems to be limited. So the underacting muscle all across elevation is limited. Okay? What do you think? Depression is limited as well. Do you see that? Depression is limited. And you can say corresponding overaction in the other eye. So what is the condition in where you get elevation also limited and depression also limited? Dr. Rashmin's answering everything here. Yes, you're right. What is it? A blowout fracture. Okay, third nerve, the adduction also will be affected. So it's a orbital flow fracture with entrapment of the inferior rectus in the left eye. Okay, next one. How about this one? You think which is the affected eye? The left eye? And how many think it's neurogenic? How many think it's mechanical? What do you think? It's neurogenic? Not very clear. Maybe neurogenic. Okay, pretty parallel though. Okay. What is the underacting muscle? You can see superior rectus, maybe a little bit inferior oblique also, but superior rectus mostly. But most of elevation is affected. Okay? And corresponding overaction on the other side. So what is the condition where you get elevation limitation in one eye? Next year we'll put the strabismus instruction course. It's a monocular elevation deficiency. Monocular elevation deficiency of the left eye. It could be an acquired superior division third nerve palsy as well. All right? Okay. Oh, and then your favorite, which is sixth nerve palsy, which we already saw. How do you take this off? Ah, there you go. Okay. Okay, I think we probably have one or two more. What's happening here? Which is the affected eye? Left eye, smaller. Mechanical or neurogenic? It's mechanical. It's kind of stretched on one direction, okay? See, look at the space here. Space here between the inner and outer is a lot more. Space here is less. So this is mechanical. And which is the underacting muscles? That is the abduction is also limited. The adduction is also limited. What could it be? Duane's retraction syndrome. Fantastic. Okay, I think there's the last one here. And what about this? Which is the affected eye? The right eye. You think this is neurogenic or mechanical? Neurogenic, fairly equal. Here, maybe a little bit less here, but fairly. What is the underacting muscle? Here. Remember, where the line is falling short, and look at this. This line is supposed to be here, and it's here. So what could this be? Where adduction is primarily affected. Come on. Third nerve palsy. Okay? So I'm going to just wrap up with one last diplopia charting just to complete. All right. So we talked about, is this crossed or uncrossed diplopia? Remember, right red eye and left green. Red eye, I'm sorry. Red glasses and left is green. So crossed or uncrossed? How many of you here think it's uncrossed? Super, uncrossed. So what is the position of the right eye? Hypo? How many think it's hypo? Brilliant, because it's higher, so the eye position is hypotropic. That's all I have to say. And once more, I invite you to the following conferences at Shankar Nethralaya Cataract Catalyst in June, the Intraocular Tumor Conference to 9th and 11th of July, and the ESO's International Vision Science and Optometry Conference to spread the word to your colleagues. And I thank you so much for your enthusiastic attendance and participation, and I wish you all the very best with your exams. And I thank all the co-instructors. We're going to break for lunch, and you're welcome to join us. And any questions, please do ask us outside. Please feel free to ask us anytime you meet us during the conference. Thank you.